grown a little bit, and I'd like to introduce you to a couple of new friends. First of all, he's from this area as well, and I'm such a big fan. You'll hear more from him later. His name is John Stoddard, ladies and gentlemen, on keyboards. Back there on the organ, he's normally behind the scenes. He's a co-producer of this record along with Hal Sachs, and he's a guy who wrote songs like You Got Me Going in Circles. But he's going to be playing organ and a few other things tonight. Ladies and gentlemen, Jerry Peters, my big brother. Ladies and gentlemen, Doc Powell on the guitar. By the time you're watching this DVD, I feel very comfortable in saying that my father and his grandfather will probably be with the Lord. And he's not there now, but he's making his way that way, and his body is checking out. But I have to say to you, the Reverend Kenneth T. Whalum is absolutely going to leave his legacy. We're going to do a song that Kyle and I wrote for him called Rev. My father, we didn't call him Reverend, we called him Rev. Many times we call him Reverend Daddy. But the awesome thing is that I've been able to watch him and to be with him during this period of suffering for him. And it's been wonderful for my brothers and I to spend time with him and our wives and just to really get up under that concept that the Bible tries hard to tell us, and that's that life is a blessing, but guess what? It's also a dead-end street. God is so gracious to us, and the Bible says that through the Lord's mercies we are not consumed, because his compassions fail not, and they're new every morning. What that is, if I could translate that, is that because of what Naima Let told you all about what Adam and Eve did, what they left us. Unfortunately, this life under the sun, as Solomon always talks about in Ecclesiastes, life under the sun, it's really jacked up. It's just that God's grace and his mercies are new every morning. So we don't get to see that. We don't get to see the soft underbelly of this thing every day. And so when we say, God, how could you let this happen to me? And I say, God, how could you let me live this life so beautifully for all this time? How could you bless me like you bless me day in and day out, day in and day out? How could you do that? Go on and praise him. He's worthy. We got time. Yes, he is. He's worthy, isn't he? How's that? Is he worthy? So my dad, even though, because he's a stroke survivor, I'm glad Hazella LeVar is here from Stroke of Hope to talk about the fact that, you know what, when you survive a stroke and all of a sudden you can't talk and you can't swallow, then you begin to remember that this is not it. God is going, that's okay, I'm just going to let the body just fade on away so that I can get you up here with me. I'm excited about it. I'm excited about him getting his reward. I don't want to lose him, but I'm jealous. So that was my sermon. They said you can't preach tonight, so we're going to play a song. Somebody said he didn't have to do it, but he did. Yeah. We're going to play a song that Kyle and I wrote.
Good afternoon, everyone. Good afternoon. My name is Nikki Tandy, and I'm with the Women's Ministry Louisville campus, and I would like to welcome you today to the Healthy Directions event. It is still Women's Month. Woo! It's Women's Month, yes. We have had a lot of great activities and a lot of great events, and this is our first in-person event, and I want to thank everyone for being here, and I want to thank everyone for tuning in online. So we have Dr. Kelly McCants, and Dr. McCants completed his internal medicine residency and cardiology fellowship at the University of Louisville School of Medicine and his heart failure and transplant fellowship at New York Presbyterian Hospital, Columbia University Irving Medical Center in New York City. Dr. McCants is board certified in cardiovascular disease, advanced heart failure, and transplant cardiology. As executive director of the Institute for Health Equity, he and his team work to address health and racial inequalities in our community by improving access to care in underserved areas, bringing awareness to historical disparities, and anchoring vulnerable neighborhoods with expanded health resources. Dr. McCants is going to talk to us today about PAD. PAD is peripheral artery disease. And just like the screen says, are you risking a stroke, loss of limb, or death? So I would like to present to you Dr. Kelly McCants.
Well, that's a warm welcome. Thank you. Good afternoon to you guys. Thanks for being here, especially on this Saturday with the weather doing what it's doing. I was reminded that this is Women's Month. Last month was, whoa, sounds like the voice of the big man talking. But last month was Women's Heart Month, and this is Women's Month. In fact, we should be celebrating women all 12 months. Let me go ahead and get that out of the way in case I mess something up. At least I'll have the crowd on my side. But it's important that we talk about cardiovascular disease in women because women often are underdiagnosed when it comes to cardiovascular disease, and that is no different when we're talking about peripheral artery disease. You know, a lot of times we're so confident when we're talking about a heart attack or high blood pressure, but peripheral artery disease is equally important, but we don't do a lot of education and awareness about it. And so as we move through this presentation, which was sponsored by Janssen Pharmaceuticals, and it's important that we have collaboration with our industry partners who also recognize the importance of African Americans, particularly women and patients in this area. And so as we move through these slides, the first one is facing the challenge. I have a few disclaimers that we need to recognize, but the whole point of this is a non-branded talk, which means Janssen Pharmaceuticals doesn't care if I mention their name at all, because the importance is on the awareness of the disease and not on the company. All right, so there's some survey instructions. You have this barcode for those online or those here also, that at the end and through the presentation, there'll be some opportunities to address these surveys. The goal is simple, is to discuss why peripheral artery disease is important and why cardiovascular disease is important as it all, or overall. The title, are you at risk of stroke, loss of limb, or even dying? Anybody that has hypertension, diabetes, and cardiovascular disease are at risk for all of these. And in fact, if you're African American, your risk is 3 to 5 times higher. So it's important that you're here. It's important that you hear this message. And it's important that St. Stephen's and Janssen Pharmaceuticals has allowed me to talk about this topic. So you may not be familiar with the term peripheral artery disease, but if you think about the arteries, they supply blood to the entire body. Again, when we talk about the heart, we call that central in terms of artery disease. When we think about the limbs, the legs in particular, the arteries that supply the brain, those areas are called the periphery. And so for me, it's all one big arterial system, in that if you have a blockage in anywhere in the cardiovascular or arterial system, you can get significant symptoms as a result. So if you have blockages in your arteries of your heart, guess what? You get a heart attack. If you have blockages in your arteries that go to your brain from your head and neck, you get a stroke. If you have arteries that carry blood supply to your lower limbs, including your legs and your arms, that is peripheral artery disease. And so I like to be clear what we're talking about early on, because sometimes the medical jargon or the medical terms can be a little bit confusing. And so we all like to eat what we eat, and many of us don't like taking medicines. And when we eat things that are high in saturated fats, all the good stuff that we eat after church, you get cholesterol deposits in these arteries. And when that happens, you decrease blood flow to either your brain, if we're talking about the arteries that supply your head and neck, to your heart, if we're talking about the arteries that supply the heart, and of course to your periphery, if we're talking about the arteries that supply the legs and the arms. So if that plaque or that blockage were to rupture, of course it can cause symptoms. Those symptoms we refer to as pain or ischemia if the blockages are significant enough to impact blood flow. And when this happens, again, it's considered peripheral artery disease. I'll skip through this slide. So what puts you at risk for peripheral artery disease? How many in the audience have diabetes? So that in itself is what I call equivalent to peripheral artery disease or coronary disease. Diabetes affects our community more than anything else other than high blood pressure. The combination of high blood pressure and diabetes puts you at an increased risk for peripheral artery disease. How many have heart disease? When we think about heart disease, we think about heart disease as a whole. To me and to an African American provider, and this room is full of African Americans, it's impossible to mention heart disease without thinking about hypertension or high blood pressure. We were just speaking earlier about the difficulty in controlling your blood pressure in general. Usually, if you're African American, you're on at least 2 to 3 pills to control your blood pressure. And often that occurs very early in age. I'm 46, already on 2 pills to control my blood pressure. And so there's something about being African American that puts you at a higher risk for these diseases, particular cardiovascular diseases, than anything else. So control your blood pressure, or you'll be at risk for heart disease, peripheral artery disease. And we've already talked about, you can forget these numbers 1 and 3, but we've already talked about high cholesterol, and I'm moving through these pretty quickly. But if I have to give you a number, ideally, this slide says 130/80, but if you're African American, ideally your blood pressure should be 120/70. So if you're not achieving that target, you're putting your arteries, your kidneys, your brain at risk for bad things happening. And how do you control your blood pressure? Of course, take the medicines are number 1. Control your diet, no salt or low salt exercise and all the things that we've been talking about for years that are difficult for us to accomplish. But if you can't control your blood pressure, remember, it's the number one risk factor for all things bad happening in African Americans. Got to make sure I hit a lot of these. We talked about cholesterol. How many in the audience take a cholesterol pill? Lipitor, Crestor, or any of the other ORs. Cholesterol pills are important in preventing the worsening of plaque development, which can, of course, put you at risk for peripheral artery disease and heart attack. If you're African American, make sure that you're on the right cholesterol-lowering medicine, and we can talk about that at the end. Weight is important. When we talk about obesity and not achieving the adequate weight that you should in terms of your adequate BMI, our people are at risk. And in fact, we start to see it in childhood. And it's mainly because the food choices are not what they should be. The food choices in the areas where we live are not the best ones, but we like that good cooking also. But if you're gonna take in improper or bad food choices, you must make sure that you marry it with the right exercise regimen to reduce your weight. And again, all of these are risk factors for peripheral artery disease. Kidney disease is a problem in our community. Raise your hand if you've been told you have kidney disease or chronic kidney disease. I don't separate the kidneys and the heart. I think they're one system. The kidneys require blood flow, and if your heart is not normal, your kidneys will not be either. I like to say, when I'm making rounds with our patients and some of the folks we teach, that the kidneys are the report card for the heart. And so if you have kidney disease, you might as well assume that you have heart disease, particularly if you're African American, to at least some degree. And of course, if you have chronic kidney disease, it also puts you at risk for peripheral artery disease. Right. There should not be any smokers in here. If you smoke, don't raise your hand, just leave the room. So, my dad often reminds me, he was in Vietnam, and in Vietnam, they actually passed out cigarettes to make sure that the soldiers kept calm. But smoking is a very difficult thing to quit and stop, but smoking is an equivalent for coronary artery disease or peripheral vascular disease. If you're a diabetic or you have high blood pressure and you smoke, you're putting yourself at a 3 to 5 time risk of worsening what's going on. And so people that smoke in this day and age, not good. We talked about exercise and the importance of it. I'm going to move through this a little quickly. How about family history? We often, in many cases, we're unaware of our family history. But if you have someone in your family, particularly on your maternal side, if they have high blood pressure, diabetes, high cholesterol, kidney disease, then guess what? That genetic predisposition is likely to be passed down. And so we get a lot of good things from our family, but we also get a lot of bad things from our family. How many are over the age of 60? Don't raise your hand, just nod. 60 is the new 50, but if you're over the age of 60, you are at risk for all things, particularly hypertension, but certainly peripheral artery disease and everything that comes with it. And then finally, being African American is a risk factor on its own, a risk factor in many ways, but especially when we talk about our heart. The cardiovascular disease is rampant in the African American community, and the worst part is that it starts at a young age. In my particular clinic, fortunately or unfortunately, I specialize in advanced heart failure, which means your heart has taken a hit from either artery disease or high blood pressure, but you get to the point where you either need a heart transplant or a mechanical heart pump. And when I see 20 and 30-year-old African Americans coming in the door, I'm reminded that our race, we're at increased risk for cardiovascular disease. All right. And so what are the signs and symptoms of peripheral artery disease? If you have leg pain that won't go away, if you're sitting still and your legs go to sleep, and that going to sleep lasts longer than it should be, that may be an earlier sign of peripheral artery disease. We are supposed to have some degree of hair on our legs. If you have legs that have no hair and you haven't shaved them, then that's an indicator that there's not good blood supply. If you have a ulcer or something on your foot that is not healing, things that heal have great blood flow. And so if you have a wound that's present that's not healing, you're likely at risk for peripheral artery disease, and that may be one of the earlier signs of peripheral artery disease. 40% of people with peripheral artery disease do not have the classic leg pain, which again, we associate with lack of blood flow. If you have a heart attack, one of the ways we know is that you get pain on exertion. The same thing happens with peripheral artery disease, but in a certain people, up to 40% don't even experience that pain. So the importance of managing peripheral artery disease, testing is important. We test for everything when you come to the doctor. There's simple blood tests that we can do, but for peripheral artery disease, make sure that you tell your physician or your provider what symptoms that you have. But when it comes to testing, there are a few tests that are important. I'll get through this in the slide presentation, but we check blood pressures. We check blood pressures in the upper extremities, and we test blood pressures in the lower extremities. The same amount of blood flow that goes to your arms should go to your legs. And if there's a discrepancy or a difference in blood flow, that's one of the ways that we know you're not getting adequate supply. This slide speaks to the loss of independence. When you have a problem with cardiovascular disease, it affects your independence. There's a slide that I often present that shows there's a direct correlation between cardiovascular disease and unemployment, particularly in the African American community. And the question is, what came first, the chicken or the egg? Either way, you lose your independence. Okay, so this slide speaks to telling your doctor about it. A lot of times when you come in to see us in the office, we're in a hurry. The clinic schedule is full. We have 15 to 20 minutes with each particular patient, but that is not your problem. When you come to see your doctor, you make sure you address everything that is bothering you. Particularly make sure you take off your socks and your shoes. It doesn't matter if you're seeing your primary care or your cardiologist. You make sure that you give someone an opportunity to address areas that we act like we don't have time for. All right. Again, we talked about wounds on your feet. We talked about skin discoloration, lack of hair, anything that looks abnormal on your lower extremities. If you have the risk factors that we talked about, we need to make sure that you bring it to the attention of your provider. There's some blood tests that can point us in the right direction that you're having a problem with cardiovascular disease or peripheral artery disease. A simple cholesterol test so that we can see if your good or your bad cholesterol is high or in an appropriate range. I talked about the blood pressure test where we put cuffs on your upper extremities and your lower extremities and try to determine the difference. But there's also an ultrasound, just like babies get or just like mothers get to determine the size of the baby. We can use ultrasound to determine if there's a problem with blood flow, not only just in your heart, your head and neck, but also in your lower extremities. And then finally, we can actually do a dye test. Anybody here has had a dye test to look at their arteries? So basically, as long as you're not allergic to iodine, and if you are, you should tell your provider, we use a contrast that we can inject in your arteries, what will show us if you have blockages or not. It sounds a little bit aggressive when we're talking about injecting dye, but it's a simple procedure. Usually it lasts only a few minutes, but you want us to know if you have blockages so we don't put ourselves at risk for loss of limb. Lower your blood pressure. Make sure you know your numbers. If you are sedentary, it means you sit a lot, you're at risk for blood clots. And so we want to make sure that if you're sitting 8 hours a day, at least every hour you're walking at least 15 to 50 steps. That way you don't put yourself at risk for blood clots. I hope this video plays. This is Dr. Stan Thompson. He's an emergency room physician. And the reason why this is important, most of our care, particularly African Americans, guess where it happens? In the emergency room. So our ER utilization in the African American population is threefold of non-African Americans. Maybe it's because of lack of transportation. Maybe it's because you can't see your provider during your work hours, but a lot of the encounters happen in the emergency room. And so let's see if we can get this video to play from Dr. Stan Thompson.
Did you know it's estimated that every 30 seconds a leg is amputated due to diabetes worldwide? And an estimated 1 out of every 3 people with diabetes over the age 50 has peripheral artery disease, also known as PAD. It is really important to understand PAD because it can severely affect your health, your relationships, your independence, and your overall quality of life. Hi, I'm Dr. Stan Thompson, an emergency medicine doctor from Nashville, Tennessee. I am dedicated to helping my community better understand and fight PAD, a disease that can put you at higher risk for heart attack or stroke if not treated early. Untreated PAD can also lead to amputation. An estimated 65,000 to 75,000 amputations are performed annually in the United States. Also, blacks are more likely than whites to undergo amputation. As a doctor who treats people with heart disease, I also see a lot of PAD patients. In fact, over 8 million Americans are living with PAD. I'm here today to answer some questions about PAD. It is important that patients always tell their doctor about any aches or pains they are feeling. Some aches and pains can be a warning sign of PAD, and if ignored, could lead to bigger issues.
Who should I talk to if I think I have PAD?
Family doctors, other types of doctors, and nurses are able to test to see if you have PAD. When you see your doctor, make sure you tell them about pain that you have and any other health problems like high blood pressure, high cholesterol, or diabetes.
How do you test for PAD?
Testing for PAD can be done at the doctor's office. There are a few tests your doctor can do to check for circulation problems.
How can I manage my PAD?
The most important step towards managing your PAD is talking to your doctor. We can now work together on managing your PAD by making lifestyle changes and by taking medications.
Do I have to treat my PAD?
Yes, we need to work together to treat your PAD. If left untreated, PAD may lead to other health concerns like amputation. I would recommend we decide on a plan to treat your PAD now. 1 year after PAD procedures, up to 70 to 90% of limbs affected by PAD and diabetic foot ulcers will be saved from amputation.
I think my family member has PAD, but they're not showing a lot of symptoms. Is it still possible for them to have PAD?
PAD does not always cause symptoms, so many people can have PAD and not know it. That is why it's important to talk to your doctor about PAD. Your risk of PAD increases if you are over the age of 50, have a history of tobacco use, have high blood pressure, have high cholesterol, are African American, or have diabetes. When you see your doctor, they should perform a checkup on your feet. Don't be afraid to take off your socks when you talk to your doctor. If you have pain, cramping, or tiredness in your legs while walking or climbing stairs, you may be at risk for PAD, which can lead to amputation. Take control of your PAD. Talk to your doctor today.
All right. So there's a few men in the room. When we start thinking about PAD, it can also cause erectile dysfunction. And so if you are having issues, make sure that you talk to your provider, and let's make sure that peripheral artery disease is not causing erectile dysfunction. PAD is hard to kind of remember. So let me just say this. When we think about blockages in the arteries, we say CAD, coronary artery disease, and we think about the periphery, we say PAD. All right. How can I decrease my risk? All those things that we talked about and then that Dr. Stan just mentioned. Be active. It has been a terrible spring for being active. It's been cold, it's been snowing, the weather's all over the place, but it's about to warm up. We have COVID at a place that we have never been in terms of the COVID numbers are decreasing. In our hospital system, throughout the week, we had less than 10 COVID cases. And during the height of the pandemic, we were up to 350. And so there is good news on the horizon, but this will encourage us to be more active. Eat healthy, and make sure, again, as he talked about, that when you're in with your provider, make sure we examine your feet, even for men who may not have the best smelling feet. Don't risk stroke, loss of limb, or death by not getting screened. There's a printed checklist that we will make available to you. We have one more video. Dr. Vita Bland, who's a hypertension specialist and family medicine doctor. We'll listen to her.
Hi, I'm Dr. Vita Bland, a clinical hypertension specialist and family medicine doctor from Greensboro, North Carolina. I'm dedicated to making my community healthier and more aware about health issues like PAD. I also have a lot of diabetic patients, and I know these patients are 2 to 4 times more likely to develop PAD. I believe it is easy to fight PAD if it is caught early. So remember, you need to go and see your doctor if you have diabetes, high cholesterol, high blood pressure, smoke or chew tobacco, and are African American. Also, you need to tell your doctor about your family history and lifestyle, and ask to be screened for PAD. Together, we can help heal our communities. Take action now. We will listen and we care, but the conversation with your doctor starts with you. Talk to your doctor today about PAD. Do it for your family, do it for your friends, do it for yourself.
Okay, survey instructions. You have this barcode for surveys and questions. There are a whole lot of resources. I don't expect you to memorize these. We'll make them available to you in case there's something that you still have questions about that I didn't speak about as it relates to cardiovascular disease and peripheral vascular disease. Thank you. All right, so we finished that part of the presentation. I'm gonna just talk a little bit about Norton Healthcare and our current partnerships with Simmons and St. Stephen's and the West End. Leah, am I okay to move on? Yes? Okay, all right. So how many of you are aware that there's a relationship or collaboration between Norton Healthcare and St. Stephen's and Simmons College? Good, good. We are excited to celebrate that. I don't need to tell you that your pastor is remarkable. Matter of fact, I'm getting some of this energy just standing in his position up here. But he and I have had a long relationship as it relates to mostly him mentoring me. And we have taken that relationship a lot further. About a year and some change ago, we made a commitment of $1.4 million to St. Stephen's Church in Simmons. And the goal is simple. We know at Norton Healthcare exactly what I just talked to you about. If we're not involved in bringing awareness to the folks that look like me and you, we're in trouble. And so that relationship, that donation, that gift is just an initial gift so that we can further our relationship as it relates to healthcare. And so long term, hopefully you will see folks in white jackets walking around your Life Center and Simmons College as we improve medical programming so that we get more people of color taking care of patients of color. We also, thank you. We've also made a $1.4 million investment in Bates. I'm a member of Bates, but when I think about Bates and St. Stephen's, to me, they're family. And so we certainly cannot bless one without blessing the other. And the Smoketown community is equally disadvantaged as a California neighborhood. And so Norton Healthcare has made an investment in Bates also for $1.4 million to their CDC, their Community Development Corporation, again, to bring awareness in medical programming to the community of Smoketown. Let's not forget Russell, the Russell neighborhood where my Center for Health Equity sits. That's about a $4 to $5 million investment in the Russell community. And the goal for our Center for Health Equity is to make sure all folks in the community are working together to move the initiative forward. In Louisville, there are a lot of people doing a lot of great things. Problem is, there's a lot of people doing a lot of great things. And often we work in silos, means we work independently of each other. The entire goal of the Institute for Health Equity is to make sure we sit down, have the right conversations at the right time to deliver the right health care to the people in the West End. And then finally, just 2 weeks ago, we made an announcement that we will be building a $100 million hospital in the West End. That partnership is with Goodwill. Goodwill invested $30 million. We initially were up to $70 million, but I think it's going to be a little bit more than that. But that's fine. The more, the better. That'll be the first hospital in the West End in over 100 years. And so when you have a healthcare organization that's investing in the community to the degree that we are, that's part of the reason that I'm here today. So I didn't want to leave the stage without letting you know that we're serious about what we're doing in the West End. Thank you.
Come on, y'all. We can do better than that. Thank you so much, Dr. McCants, for coming and sharing with us. I just want to make sure that we don't have, I might be out of order, but did we do questions and answers? Y'all got some questions? Because, see, while we got them here, we might want to go ahead and take advantage of it if y'all got some questions.
Yeah, I'm happy to answer any questions.
Stand up. If you have a question, raise your hand and stand up and be recognized so we can make sure we get it. Yes, ma'am.
Thank you, and thanks for that question. And this is a perfect question. This is an example of the medical community not doing a good job at communicating to patients. What someone should have told you is that 60% is normal. It's not out of 100%. It's actually out of 55 to 60%. So now while you're home worrying about a 60%, which when I was in school, that was a D. But when it comes to your heart, that's an 8. And so again, this is an example of us not taking time to communicate to you that 60% is normal. What do you say, brother?
Good afternoon. I walked in when you was toward the end of your PAD presentation. How does neuropathy fit into that?
So another very good question. So neuropathy, neuro meaning nerves, pathy meaning disease, ties very well into peripheral artery disease. And for all practical purposes, there's 2 main reasons that people get neuropathy. It's either diabetes or peripheral artery disease, means lack of blood flow. And neuropathy simply means all the symptoms that I described earlier. If you have tingling in your legs, or you feels like you're walking on pins and needles, or perhaps you don't feel anything. Somebody could poke you with the needle and you won't even know it. That's what neuropathy is. And so if you have neuropathy, you definitely should be screened for peripheral artery disease. Yes, ma'am.
Yes, I wanted to ask the question. I have just about almost everything on that paper, but I'm having problems now. A short of breath, and they're gonna do an echo on me. They have done everything. I am so short of breath. I'm a diabetic. Everything's wrong, and cancer and all. So I would just like to see, will the echo, will that help my heart to see why I'm so short of breath?
Yes, ma'am. And thank you for that question as well. Let's refer back to the young lady here. So the reason she knew she said her heart was pumping at 60% is because that came from an echo test. And so that'll tell us if your heart muscle is normal or abnormal. But as you and I kind of talked about before I started, until your blood pressure is adequately controlled, you are going to be short of breath. And so it's our job to control your blood pressure regardless of what the echo test shows. All right.
My question is, I've been recently taken off of medication for diabetes. Am I considered still diabetic even though I'm not on medicine anymore?
Great question. I can't answer that question. And I think I was supposed to say in a disclaimer that this advice is in no way supposed to supersede your physician visit. Leah, I was supposed to say that, my bad. But anyway, I'm not sure what the medicine was you were taken off of, but if metformin. Metformin is a good medicine, and we use it for people that have diabetes or who are at risk for having diabetes. And but the fact that it was removed, if nothing else was added, that means that your diabetes is better controlled. But let's make no mistake, you're still African American. And I can barely see back there, but I think you're over the age of 30. So you're still at risk.
Yes, doctor. Does stress play an impact on PAD? I know since COVID, a lot of people have experienced a lot of stresses, but does that play an impact on PAD?
Very good question. Stress has an impact on everything, direct and indirect. There was a study that came out that said the fact that if you are racially conscious, means if you have conversations about race and you are a woman, your diastolic blood pressure is up by 5 to 10 points just by the nature of you saying that you're an African American woman and having to defend something. All right. And so I already said that hypertension puts you at risk for all of it. So I would say yes, that stress puts you at risk via high blood pressure for peripheral artery disease. All right. This last one, I'm going to have to start taking some copays up in here. I'm just kidding.
My question is dealing with PAD in the lower limbs. And so when you treat for PAD, how do you treat it?
Great question. We treat number one by modifying whatever risk factor or what the cause is. And then two, there are medications that are blood thinners that are very useful in treating peripheral artery disease and preventing it from getting worse. And that's one of the benefits of having a relationship with Janssen, is that they're bringing awareness to what we're doing, but they also are available to help treat.
Okay, and so one question, like I do have PAD, and I was treated with stent implants, but what happens after that?
Sure. So if you had PAD to the point where we had to put a stent in to push that cholesterol back and open the artery up, that is the first step. The second step, you should also be on an aspirin and a blood thinner, and you should also be on a cholesterol pill. And so those are the things that you should be on, and your physician or provider should have recommended an exercise regimen for you. Those are the main 1, 2, 3, and 4 things. $15 copay though.
Dr. McCants, did you say, where are you you said you were in Russell. Where are you located?
So our Center for Health Equity is in Russell at the corner of 12th and Jefferson at Molo Village. I'm sorry? The new building, yeah. That's for health equity, but my office is at Audubon on Poplar Level, yeah.
Can y'all hear me now? So I was borderline for high cholesterol, and so on the verge of taking medication, and I got my cholesterol down. Should I be screened for PAD?
Do you mind telling me your age?
I will be 44 this year.
So you have high blood pressure?
No.
Okay, so just the cholesterol?
Yes.
Yeah. So if you're not on medications for cholesterol and you're not hypertensive, and you're under the age of 40, you are probably okay at this point. But as you're being closer to the age of 50, you certainly should be screened. Okay. Or if you can't keep that cholesterol under control.
Right. Thank you.
Good job. Yeah.
Doctor, I want to know how you can find a doctor for your feet. I mean, I've got specialists for everything. When I was 50, I've had a stroke. And at the same time, they took something in my body to stop that. I had 3 strokes at the same time. I've seen every kind of doctor. I'm still here and I smell. But sometimes I get tired of going from doctor to doctor. I know you need to look at your feet because I used to go and I stopped. I don't know why. But how can you find a good doctor with the feet?
Very, very good question. A foot doctor is a podiatrist, and I can tell you they're extremely difficult to come by. And I have to do a little research to see who at Norton Healthcare specializes in podiatry. But a lot of that should be handled by your primary care provider. So I'm not sure who your provider is, but what you're describing and everything that you're describing can be handled by your primary care provider. They just need to make sure they take the time to do so. Because the podiatrist is more of a Proceduralist means cutting off bunions, toenails, and doing things like that. They make some recommendations about foot inserts, what you put in your shoes. But what you're talking about should be handled at the primary care level. All right?
I think I might be the final question.
Yeah.
So is that a $50 copay?
No.
Okay.
I'm going to pass the collection plate around in a minute.
Well, my question is about small vessel disease. And that alone, I think, is a risk of stroke, if I understand it correctly. How does it relate to PAD? Or is there a relationship?
Very, very good. So when we talk about PAD in general, we're talking about large vessels, but small vessels or microvascular disease often are precursors or the earlier vessels that are affected before you get to the larger vessels. And so in my mind, it's one and the same. If you have small vessel disease, then either you have PAD or you're in the early stages to where we can prevent it from worsening. All right. Unless you want me to sing or something, I need to.
Sing. Go on. You are more than welcome to sing if you want to, as long as I'm allowed to laugh.
Thank y'all.
Thank you all again. So would you all like to have more of these types of open forums? Yeah. I think it's important. We don't get a lot of information, and I think small, intimate settings like this gives us that opportunity to be able to ask questions. I need to make sure when you came in, everyone who registered, you should have gotten 2 tickets. There's a yellow ticket. It's for your lunch. Does anybody not have a yellow ticket? Raise your hand. Michelle will get you. Okay, I see 3. Okay, 4. We did pretty good. Okay. And then you should have received a pink ticket. And it said you should have the part that says keep this coupon. Who has a pink ticket that says ticket? Okay, stand up so I can see you, because we gave you the wrong ticket. We need to give you another ticket. If you have keep this coupon, that's the one you should have. But if your pink ticket says ticket, we need to get that back. Okay, I see. She's coming. Let her finish getting those out before we do the drawing. So we got 2 drawings that we're going to do. Those with those pink ticket coupons, keep your hand raised. We want to make sure you get a chance to win. Thank you all so much for your patience and for coming out on this Saturday afternoon. We ain't been able to come out and fellowship in a long time, and it just feels good to see y'all. I still got some pink tickets up here. They need the right pink ticket. Anybody else need a lunch ticket, the yellow ticket? They should have the one that says keep this coupon. I need the one that says ticket. Switch it. Just give them a whole new ticket. Michelle, I need a lunch coupon over here. Reverend Linda Bunton needs a lunch coupon. And for those of you who are joining us online, thank you so much for your attentiveness, and we really appreciate it. We wanted to make sure that we offered this information to our online campus as well as our in-person campus attendees. And we appreciate you being here. We hope that something was said that you got some great information. And hopefully next time you'll be here on campus with us. Okay, Michelle, you got any more lunch coupon? I need one right over here. Reverend Linda Bunton. She's still going the other way. So as soon as we leave here, we're going to go over to the gym in the Family Life Center, and lunch has been prepared, and we've also got some little goodie bags. You know, I believe if you've been somewhere, you need to feel like you've been somewhere. Get something to take home. Michelle, come this way. I need a lunch ticket over there. Oh, wait a minute. I think she got it. Okay, what else? Anybody else need anything? We got one lady right here. She needs a ticket. Okay, and then bring me all of the pink tickets, so we can go ahead and do the drawings. And see, we're going to be in and out within an hour. Isn't that good? Okay, yeah, that's fine. Shout out to the men who are in the room today. Thank you so much for coming and participating. Shout out to our new women's leader, Nikki Tandy, on our Louisville campus. Yeah, her mama thebomb.com. Grandma, the whole family, you know. Okay, so here we go. So the first thing I'm going to draw for is on April 1st and 2nd, I'm going to be participating in a musical called Spring Sing, a tribute to the Ladies of Soul. And so I was able to get our producer to give me 2 tickets to give away today. So the lucky winner, I'm looking for pink ticket 055178. You win. Come on up. Did you just get that ticket? That's it. Congratulations. All right. And the next one is for Mother's Day, the Melanin Art Series does portraits. And Charles Rice, who is a renowned local artist, is giving away one of these portraits. And so you got that one? Okay. All right, so let me get in here. Same pink tickets, just keep looking. Let's see. 055222. Okay. Come on, y'all. We got to let him win something. Come on. That's it. All right. See, it's good to be among women, ain't it? All right. Well, that concludes the session for today. Thank you all again for coming out. We're going to depart from here, and we're going to go over to the gym for lunch. So I'm going to say a quick prayer real quick so that we can close out. Dear Lord, how we thank you for this day, God. We thank you for all that we have heard and seen on today, God. We thank you for the valuable information that has been shared on today. We thank you for Dr. McCants, who is willing to come and share the information with us, God. Now we ask that you would be with us throughout the day and whatever we have to do today, God. We just ask that you would continue to lead and guide us. We ask that you would allow this information to take a hold of our minds, and that we are mindful of the information that we received on today. And God, we ask that you would bless the food that we are going to receive for the physical nourishment of our bodies. In Jesus' name and for Christ's sake, we pray. Amen.